Welcome to part 2 of our 4-part series on how to support your child or adolescent with sleep. My name is Dr. Caroline Gibbs and I'm a clinical psychologist for South West London and St George's Children's Wellbeing Service. In part 2, we're going to focus on how to establish a good bedtime routine with your child. So why is this important? Well, it teaches your child the order of events leading up to bedtime. And this way your child is given really clear messages about what's coming next. And then by making the afternoon and early evening predictable, you're likely to reduce their anxiety levels at bedtime. Routine also provides boundaries, which offers a child safety and protection, and it lets them know what is expected of them. So how can we support our child to learn new behaviours? Well, from a young age, children learn that different behaviours lead to different outcomes, and they learn to link a particular behaviour to what's going to happen next. So if they come out of their bed, they might learn that you get up, get your attention, and that you spend some time with them. Perhaps you might read them a story or take them into your own bed. So if a behaviour is rewarded in this way, it's more likely to happen again. The child has learned that their behaviour leads to something they like, a bit more time with you. And even if they get out of bed and are being told off, essentially they're getting more attention than they would have if they'd stayed in bed. A cup of milk in the middle of the night or a cuddle when they climb into your bed acts as a reward, and when repeated, it becomes a link between their behaviour and your response. When a child changes their habits to a desired behaviour, we really recommend that it's rewarded quickly with lots of praise, or sometimes, if appropriate, a low or no cost reward. And to do this every time until that new behaviour is well established. At this point, the rewards, low or no cost, can stop. The praise can continue forever. If a certain type of behaviour is ignored, it's less likely to happen again, because for many children, being ignored is worse than being punished. So how to create a good bedtime routine? So we want to keep the routine simple and choose activities that are relaxing so that your child realises it's time to start winding down and get ready for sleep. It shouldn't include TVs, laptops, tablets or gaming or any lively games. And a routine needs to ensure that the winding down of the afternoon avoids overstimulation that children might be more sensitive to. It's also really important to be consistent with your routine so your child knows exactly what's happening and what to expect. We suggest that the routine should take around 30 to 45 minutes and contain a definite endpoint, so a cue for your child to associate with falling asleep. This might be turning off the light and having a particular goodnight phrase or a short lullaby or song that you might use each night. So this is a really common bedtime routine. We're going to go into a bit more detail in a few slides' time, but just to give you an example, it might be taking in a bath, putting on pyjamas, combing, brushing hair, brushing teeth, reading a book, and then into bed. So how much sleep does your child need? Well, a bedtime routine will help you to move your child's bedtime to the desired time. So here's a reminder of how much you should be aiming for based on your child's age. And obviously there is some variation here, but this is just to give you a guide as to roughly how much they will need at night. And to determine your child's bedtime, what you want to do is subtract the average number of hours your child should sleep for based on their age from the time that you need them to get up in the morning. And how can you change your child's bedtime if you've calculated that they're currently going to bed too early or too late? Well, it's best to do this by 15 minutes each night, and this gradual approach will be much easier for both you and your child than a very large and sudden change. Children who fall asleep too late or too early can have a problem with their body clock, and there are a few things that you can do to adjust it. We covered some of these in the first video. But as a reminder, try to have a fixed wake-up time, including at weekends if possible. Encourage your child to get lots of natural light in the morning and to avoid bright lights in the very early morning or near bedtime. So that's why those blackout blinds or thick blinds or curtains can be really helpful, especially in those spring and summer months. It's also important to avoid daytime napping once your child is roughly over the age of 3. But if this is too difficult, then you might need to schedule an earlier daytime nap Keep it reasonably short and ensure that they're awake by 3 p.m. As you're gradually moving your child's bedtime routine in the evening, it's also important that you shift the morning routine too. So for example, children who wake early tend to eat breakfast very early. So if you're moving everything 15 minutes later, you also want to move their breakfast 15 minutes later too. It's really important that your child learns a clear difference between day and night. So if you can, make your bedroom a really peaceful and calm place with soft lighting at bedtime. As you're settling your child ready for bed, you might also want to be a little bit quieter and slightly less engaged in conversation so that they see a difference in your signals. So it's not about being robotic, but just signalling to them that it's winding down. It's not a time for playing or having a chat, but just to sort of get ready, settle down and get into bed. Some children will want a lot of help to settle, so you might need to give them a big cuddle as they fall asleep, and some children will want you to stay in the room with them where they can see you until they've fallen asleep. But if you can teach your child to fall asleep on their own without any assistance, you're really setting them up for good sleep habits for the future. All adults and children move between light and deep sleep throughout the night, and this is called sleep cycles. And in a light phase of sleep, things that are different in the surroundings might wake us up fully. So if you cuddle your child to sleep at bedtime, they might expect you to be there for a cuddle when they come into their light sleep. And similarly, if you were sitting in the room when they fell asleep at bedtime, they're much more likely to need you to be there again when they wake in the night to resettle. And again, things that have changed in their environment. So if you have night lights that go off, or you're playing a lullaby when they go to sleep and that goes off, they might be confused or sometimes even distressed and find it really hard to settle back to sleep because they want everything to be as it was when they went to bed. So here's a reminder of a possible bedtime routine, but we're going to go into a little bit more detail this time. So you want to choose your reasonable bedtime, and again adjusting this by 15 minutes each night if you feel you're quite significantly out. You want to start a relaxing routine about an hour before bedtime. So in that 30 minutes before you're doing the wash and getting them dressed for bed, you want to be getting them engaged in activities that are calming and not stimulating. So it might be crafts or jigsaws, reading books, or perhaps playing with Lego. You don't want them to be kind of playing in very active games or being very, very stimulated at this time. And it's also best if you can to avoid them eating at this time, but if they're really, really hungry, any snacks you do give must be low in sugar. At about 30 minutes before bedtime, you want to go to the bathroom, and from here it's quite important to set a bit of a boundary that they're not going to go back to those play areas, so the living room or maybe the kitchen. The aim of the bathroom really is to clean off the dirt and clear away the day, but it's also an opportunity for your child to unwind, and it helps you to provide a really clear step from the daytime activities to the bedtime phase. So if you do happen to have a bath, you could do this for 15-20 minutes, but if you don't have a bath, a warm flannel wash or a shower is just as good. Okay, your next step, you're going to take your child into their bedroom. You might have a little bit of a chat, get them into their pyjamas, and then we suggest you might want to read them a story, or perhaps you might listen to a story together, and then switching that off before they get into bed. And then it's really important to remind you not to let your child have exposure to blue screens here, blue light, so laptops or iPhones or tablets. And then you're going to settle them into bed. And the last step of your routine here is to say goodnight and perhaps have a phrase that you might be able to repeat if you need to. It's a clear signal and a cue to your child. This is what you're going to say before you go to bed. And so each night that phrase becomes their kind of signal. And your goal then is to gradually distance yourself from the child's bedroom. And you might need to do this in a series of steps if they're used to you being in the bedroom when they fall asleep. And this might take just a couple of days, but for some families where it's a bit more complicated, it might take a couple of weeks. So be confident that your child will eventually learn the new bedtime routine. If they are used to having you in the room when they fall asleep, you can explain to them that you'll do this for a few more nights, but then what you're going to do is you're going to start moving away so that they learn to fall asleep on their own. So you might begin by being near them at the side of the bed, And then over time, you're gradually going to move away. So to the end of the bed, by the door, and eventually outside the door. And after you've said your goodnight phrase, you really want to limit any more interaction with your child. So our top tips: consistency is key. So your child is much more likely to learn this quickly if you behave in the same way every night. So the same routine, the same responses to resettle them when they wake in the night. And we've also talked about using reward where the desired behaviour is demonstrated. So again, praise here is really, really key. Lots and lots of praise. You can't praise enough. And also, if it is appropriate, you might give a low or no cost reward. And it's really key that any rewards, including praise, is offered as soon as you can. So the next morning, really want to give them that reinforcement that you're really proud of them, you're really pleased with what they've done, and this is what they can get. And it's important to be firm and clear, but you can do this while still being warm and nurturing. You don't have to be kind of militant with them. Sounding as if you know your child can do it will help them to feel safe and reassured. And it's perhaps worth mentioning that when you do change these habits or you do shift things in their routine, you might notice that your child behaves perhaps slightly worse for a couple of days. This is really, really normal. This is your child testing out the rules, seeing what happens if they try and push the boundaries. How will you respond? So just stick to your guns, stay consistent, believe in what you're doing. And over a couple of days, they should really get the hang of what's going on. Okay, thanks for joining. And our next topic in part 3 is going to be common bedtime problems, and we'll offer some suggestions and solutions to these. Thank you.